Hello everyone. Today we will start learning about evaluation. So, designers often assume that if they like their design, others will too, but users think and act differently. Evaluation helps confirm whether a product truly meets users' needs instead instead of relying on assumptions. It's a structured process where we collect real data on how users perform tasks. This evidence helps identify what works well and what needs improvement. User centered design follows a continuous cycle: design, evaluation, and redesign, and it ensures constant improvement. Evaluating early saves time and cost by catching problems before release. And in the end, usable systems don't just please the users, they boost efficiency and business success, making evaluation a vital part of a good design. When designing a product, we can't just rely on design rules or our own opinions. Guidelines are helpful, but they don't show how real users will react. That's why evaluation is essential. It helps us see if people can actually use and enjoy what we have built. Today's users expect more than just working software. They want products that feel simple and even enjoyable. Evaluation lets us check for that experience and not just basic usability. By following an interactive design process, designing, testing, and redesigning, we can catch problems early before launch. This saves both time and money and helps the team focus on solving real issues instead of guessing what might go wrong. Finally, with so many types of products today, from apps to devices, evaluations must adapt to different user needs. Doing it well ensures not only usability but also satisfying, engaging user experiences. When deciding when to evaluate, the approach differs depending on whether we are developing a brand new product or improving an existing one. For new products, designers often start by creating sketches or mock-ups to test ideas and gather reactions from their potential users. So, this early evaluation helps determine both the market need and the user's expectations before heavy development begins. For upgraded products, the focus shifts toward refining what already exists. Here, evaluation often compares user performance and satisfaction with earlier version to identify improvements in usability. This method is common in systems that go through multiple releases, such as different digital softwares. There are also two main types of evaluations to consider. Formative evaluation happens during the design phase to ensure the product stays aligned with user needs, while summative evaluation occurs after completion to measure the product's overall success. Finally, recognized organizations like NIST, ISO, and BSI provide standards that help maintain consistency and quality in evaluation process. Um, so, what is HutchWorld and how it began? HutchWorld was a joint project between Microsoft Research and the Fred Hutchinson Cancer Research Center that began in the late 1990s. Its purpose was to support cancer patients, especially those undergoing bone marrow transplants, who were isolated for long periods due to immune suppressions. The goal was to create a comforting online community where patients, family, and caregivers could connect, share experience, and find emotional support. So the system was envisioned as a 3D virtual world that resembled a hospital setting. Users could move through areas like lobbies and lounges using different avatars, simulating a sense of togetherness despite physical separation. This concept made Hutch World one of the earliest examples of virtual health communities focused on emotional well being. The design process started with close collaboration between technologists and healthcare professionals. Before any coding, the team observed real hospital environments to understand what comfort and interaction meant to patient. They began sketching ideas for how the virtual space might look and feel, eventually deciding on the lobby metaphor to mirror our real hospital social spaces. Prototypes were intentionally simple at first, like sketches, mock ups, and storyboards, so users could easily react and give feedback. This early input from both patients and medical staff was invaluable, helping the team ensure the environment felt welcoming rather than clinical. The interdisciplinary approach ensured that the design balanced technological capability with emotional sensitivity. The evaluation began with on site observations. Designers spent time in hospital wards watching how patients interacted with technology and each other. They noticed that patients was looking for simple, emotionally engaging tools rather than um, complex interfaces that has so many options. This led to redesign focused on intuitive navigation, personalized avatars, and familiar layouts. And next, formal usability testing was conducted. Patients and caregivers used the Hutch World while researchers recorded their reaction, performance, and comfort levels. These sessions revealed usability challenges but also strong emotional responses. Participants felt less isolated and more connected. After several redesign cycles, the system successfully supported patients' social need and demonstrated that thoughtful user centered design could enhance well being and not just usability. The Hatchworld evaluation offers valuable insights into how multiple evaluation techniques can work together throughout the design process. At the early stage, informal or quick and dirty observation helped the team spot immediate usability issues by watching how users naturally interacted with the prototype. They followed this with structured usability testing and redesign sessions, which uncovered deeper problems in navigation and interaction flow. Still, testing alone wasn't enough. The team needed to understand how the system fit into patients' everyday medical routines and emotional states. So they turned to different field studies, which is equally important. And Also, they wanted to listen to users' voice directly through questionnaires and interviews. The team learned what patients appreciated, what frustrated them, and what truly supported their emotional needs. By combining these approaches, the designers built a holistic understanding of usability, but they also faced real challenges: limited user availability, tight schedules, ethical boundaries, and budget constraints. Despite these hurdles, the Hutch World study showed that blending different methods give a more complete and realistic picture of how a system performs in the real world. So that's all for this chapter. I look forward to see you in the next one.